Welcome to Pharmacy with Sabir. Okay, let's dive right into this. Today, our explainer is focused on demystifying one of the absolute most persistent paradoxes in all of medical science. We're talking about the placebo effect. We're going to look really closely at this remarkable alchemy of expectation and see exactly what happens when the lines between belief and biology start to blur. Now imagine this scenario for a second. You are in severe discomfort. A doctor hands you a pill and tells you, with absolute confidence, that it's a powerful, fast-acting painkiller. You swallow it, and within 20 minutes, your throbbing headache completely disappears. You feel immense relief. But here's the catch. That pill had absolutely zero active medicine in it. It was a complete fake, literally just a sugar pill. So we really have to ask ourselves, can a pill with no active medicine actually make someone feel better? Is this just magic? Some kind of trick of the mind? Or is your brain simply far more powerful than you ever thought possible? Section 1. The mystery of the placebo. So what exactly is it? Well, the placebo effect isn't just about thinking you feel better. It's an actual, documented phenomenon where a patient experiences a real, measurable improvement in their condition after receiving an inactive substance or a fake treatment. I mean, picture those cinematic hospital scenes. A patient is given an IV drip or a tablet containing nothing but saline or sugar. Yet their heart rate stabilizes, their breathing comes down, and their pain actually subsides. This isn't an illusion, it's a physical reality, and honestly, it plays an absolutely foundational role in modern medicine and drug development. Section 2, the neuroscience of expectation. Now, what's really interesting about this next part is how the biology actually works. Let's break down the neurobiology here. It all starts with step 1, expectation and belief. When you truly believe you're receiving a treatment, your prefrontal cortex, the area of your brain responsible for complex thinking and anticipation, lights up. This leads right into step 2. As those neurons fire, they trigger the release of incredibly powerful neurotransmitters. We're talking about dopamine, which is linked to reward, and endorphins, which are essentially your body's own natural painkillers. These molecules bind to their receptors and kick off this massive chemical cascade. Finally, we reach step 3, altered perception of symptoms. Because your brain has literally flooded itself with its own internal medicine, the way your central nervous system processes pain or distress is physically changed. Your belief has quite literally altered your brain chemistry to create real relief. It is wild. Section 3, placebos in clinical trials. Now, you've likely heard of this next concept in medical literature, randomized controlled trials, or RCTs. An RCT is a scientific study where participants are randomly assigned to either a treatment group or a control group. In double-blind studies, neither the doctor nor the patient knows who is getting the real drug and who is getting the sugar pill. So why is this so absolutely crucial? Well, pharmaceutical companies must use these placebo-controlled trials to prove if a new medicine truly works on a molecular level, or if the patients are just feeling better simply because they expect to feel better. It's the ultimate test of efficacy. This brilliantly illustrates how comparing these two groups isolates the actual medicinal effect from the brain's expectation effect. On one side, we have the treatment group receiving the active, real medicine. On the other, the placebo group receiving the inactive substitute. It's a high-stakes comparison. If the brand-new million-dollar drug doesn't significantly outperform that simple placebo, well, it goes right back to the drawing board. Section 4, conditions treated by placebos. Now, let's be clear. The placebo effect isn't a magical cure-all. A sugar pill isn't going to shrink a tumor or mend a broken bone. But the placebo response is particularly strong and well-documented for specific conditions like pain, migraines, depression, anxiety, Parkinson's disease, and irritable bowel syndrome, or IBS. You might be wondering, why those specific ones? Well, it's because these are conditions heavily regulated by the brain and the central nervous system. When the brain releases dopamine, for instance, it can temporarily improve motor function in Parkinson's patients. When it releases endorphins, it directly combats pain and migraines. Essentially, the brain's internal pharmacy is perfectly stocked to manage these specific neurological and pain-related conditions. Section 5, the ethical boundaries. Of course, we have to talk about the ethics because there is a major boundary in medicine here. On one side, we have placebo research. This is entirely ethical and absolutely essential for drug testing, assuming there's informed consent. But on the other hand, we have clinical practice. Doctors generally do not, and ethically should not, prescribe fake medicines to their patients outside of a strict research setting. Doing so would break the fundamental trust between a healthcare provider and a patient. Deception, even if it's for a positive outcome, is highly ethically fraught. Plus, relying on a placebo simply cannot replace evidence-based medicine when real underlying pathologies need to be addressed.
Section 6, the dark side, the nocebo effect. Let's move to this and see how it builds on what we've just learned.
So, the dark mirror of the placebo is known as the nocebo effect. This is a phenomenon where a patient experiences negative side effects simply because they expect them to occur. Imagine a doctor warning a patient that a new medication might cause nausea. Even if that patient is only given a harmless sugar pill, their intense anticipation and anxiety about getting sick can cause their stomach to actually churn and produce real, clinical symptoms of nausea. The mind creates the misery. This contrast really shows the full spectrum of how powerful our beliefs are in dictating physical realities. The placebo harnesses positive expectation to create healing and relief, but the nocebo, it harnesses negative expectation, fear, and anxiety to create genuine harm and discomfort. It is a stark reminder to medical professionals that the very words they use, the way they explain things to patients, can directly alter physical outcomes. Section 7, the future of healing. So, where is all this taking us? Today, advanced fMRI brain imaging is literally allowing us to watch the placebo effect happen in real time, mapping the exact neural pathways involved. It's like watching the brain heal itself on a monitor. This incredible technology is paving the way for personalized medicine, where we might actually predict which patients are strong placebo responders based on their unique genetics and neurobiology. We're also seeing AI being utilized in clinical trials to better separate the placebo signal from the drug signal. The ultimate goal here isn't to trick patients. No, it's to find ethical ways to harness these natural placebo mechanisms, combining a patient's positive belief with proven, evidence-based medical treatments to absolutely maximize healing. Section 8, key takeaways. Let's distill everything we've learned down to the essentials. So, the crucial point is this. First, the brain and body are deeply and inextricably connected. Second, your expectations can literally alter your brain chemistry, releasing dopamine and endorphins to create real, tangible relief. Third, as powerful as they are, placebos are most essential as a scientific tool in clinical trials to prove a drug's true worth. Fourth, never underestimate the nocebo effect. Negative expectations can and for sure do cause real harm. And finally, while belief is undeniably powerful, placebos do not and cannot replace proven evidence-based medicine. The placebo effect shows that the brain and body are deeply connected, but it is not a replacement for proven medical treatments. Understanding this phenomenon helps us improve healthcare and develop better medicines. If you enjoyed this explainer, like, subscribe, and join Pharmacy with Sabir for more evidence-based pharmacy education. I'll leave you with one final question to ponder. If your mind is powerful enough to cure a headache with a fake pill, what other incredible capabilities are hiding inside your own neurobiology, just waiting for you to believe in them? Thank you so much for learning with us today.